34 million. That's how many prior authorization requests American insurers received in 2022 alone. 1 in 4 were denied, and your doctors, spend 13 hours every single week just on paperwork to fight back. This is not an accident. It's called prior authorization, and it's one of the most quietly infuriating systems in American healthcare. Here's how it works, why it exists, and why 80% of the people who bother to appeal actually win. Let's start simple. Prior authorization, or prior auth, is a permission slip before your doctor can prescribe a medication, order an MRI, or schedule a surgery. Your insurance company gets to decide whether they agree it's necessary. Think of it like getting a building permit, except the building inspector has a financial interest in making you wait. Your doctor fills out the request. Your insurer assigns someone to review it. And then you wait. The American Medical Association says the average review takes 3 to 14 days. That's 3 to 14 days where you don't have your medication. 3 to 14 days where your condition can get worse. 3 to 14 days that have nothing to do with your health and everything to do with cost management. Here's the thing. Insurers will tell you prior auth exists to prevent unnecessary care. And technically, that's true. Sometimes doctors do order tests that aren't needed. Prior auth was originally designed to catch those cases. But the system has drifted way off course. 94% of physicians say prior authorization has delayed necessary care for their patients. 33% say those delays have led to a serious adverse event, a patient getting worse, a hospitalization that could have been avoided, in rare cases, something worse, and that 1 in 4 denial rate, 80% of those denials get reversed when the doctor appeals. 80%, that means the insurer was wrong 4 out of every 5 times someone bothered to fight back. The problem is most people don't fight back. Most doctors don't have time to fight back. 13 hours a week of paperwork per physician in a country that's already short on doctors. So who benefits? Follow the money. When a prior auth is denied and the patient gives up, the insurer doesn't pay. Full stop. That's the financial logic. Delay long enough, deny enough, and a certain percentage of people will just stop trying. They'll skip the medication, they'll postpone the procedure, they'll pay out of pocket, or they'll wait. United Health Group, the largest insurer in the country, processed over 1.1 million prior auth requests in 2022. Their denial rate was 22%. They earned $22 billion in profit that year. That's not an accusation, it's arithmetic. Here's what's actually changing. In 2023, CMS, the Centers for Medicare and Medicaid Services, issued new rules requiring Medicare Advantage plans to decide urgent prior auth requests within 72 hours. States are passing their own laws. The American Medical Association is pushing the Gold Card Act, a bill that would let high-performing doctors skip prior auth entirely for certain services. Progress is real, but it's slow. And in the meantime, your doctor is still spending 13 hours a week asking for permission to do their job. 3 things to remember. Prior authorization is a delay tactic, not a safety check. The data says so. 80% of denials that get appealed are reversed. And if you get denied, appeal every time, because the system is betting you won't. If this made you angry, good. Subscribe, and next week we'll look at the Charge Master, the secret price list. That's the reason your hospital bill makes absolutely no sense.